Welcome back to Minority Med Project, where we discuss minority health, representation i- in medicine, and the issues shaping healthcare in our communities. Today, we're tackling one of the most widespread chronic health crises in the United States: diabetes. Diabetes is a condition that affects how your body turns food into energy. While it is a major public health concern for the entire country, it hits communities of color disproportionately hard. According to data from the Center for Disease Control and Prevention, Black, Hispanic, and Indigenous adults are significantly more likely to be diagnosed with diabetes than non-Hispanic white adults. Even more concerning, minority populations experience much higher rates of severe complications from the disease, including kidney failure, vision loss, and lower limb amputations. To truly understand why these disparities exist, we have to look past the outdated idea that diabetes is simply a matter of individual power or bad choices. Instead, researchers and medical professionals point towards deep-seated social determinants of health. A primary driver is the lack of health equity in everyday environments. Many minority families live in areas known as food deserts, where fresh, nutritious, and affordable food are scarce, leaving heavily processed, high-calorie options as the only accessible choice. Managing or preventing diabetes requires a balanced diet, but that becomes incredibly difficult when a neighborhood lacks a basic grocery store. Physical environment also plays a massive role. Neighborhoods with limited space and green spaces, sidewalks, or recreation centers make regular exercise a challenge. Furthermore, the chronic stress of financial instability, housing insecurity, and systematic discrimination triggers hormonal responses in the body that can elevate blood sugar levels and increase insulin resistance over time. Access to quality healthcare is the final piece of the puzzle. Early detection through routine blood work can catch prediabetes before it fully develops. However, due to gaps in health insurance, transportation barriers, and a shortage of culturally competent medical providers, many minority patients are diagnosed much later when the disease has already begun causing damage. The encouraging news is that type 2 diabetes can often be managed, delayed, or even prevented with the right resources. Bridging this health Bridging this health gap requires a community-wide effort. It means investing in community gardens and affordable grocery stores in underserved areas, expanding mobile health clinics, and training healthcare providers to offer culturally tailored nutritional counseling. By addressing the root environmental and systemic causes, we can give every community the tools they need to live healthier, longer lives. Thank you for listening to Minority Med Project. Join us next time as we continue exploring the topics that shape minority health and the future of medicine. This is Minority Med Project, educating, uplifting, and inspiring.